Coach Kim Thomas here, seasoned personal trainer, ready to test those hips. We're going to do a little hip flexion test to test your range of motion. So you just need a towel, a yoga mat, a floor, get somewhere comfortable. And remember, with any type of exercise, always check with your doctor first. All right, guys, we're doing our hip flexion test. So let's go ahead and get in the position where you're on your backs. Get nice and comfy. All right. So I want you to pull one knee into chest, put one hand or both hands on top of that knee, pull it in. We're just going to give you a nice little warm up before we get into our test. So just pull one knee into chest. Let's go ahead and do two on each side. So pull that knee just nice and gentle. We're not trying to beat ourselves up here. We're just going to do a nice little test. Perfect. All right. So what I need you to do is extend one leg out straight on the ground. You're going to pull the other knee into chest, put your hands on top. If you can only get up to 90 degree right here without pain, this would be considered poor. Okay, you want to make sure that that leg doesn't lift up like so. You want to keep it nice and flat. So if you can bring that knee in a little bit more past 90 degree, that'd be considered average. And again, make sure that other leg is nice and flat. And keeping that knee, don't let it pull out to the side, but pull it all the way in. If you can bring it all the way where it touches your body, that is considered really good. Okay, so we're going to test each leg separately. A lot of times it's very normal. One leg is a little more flexible than the other. And you guys, if you get poor, don't worry about it. All is well. You can always stretch, get a little bit better, and you might be limited if you have hip and knee issues. So let's go ahead and pull one knee into chest, see how far you go. Go ahead and get ready to score. You're scoring yourself. Make sure that leg is flat. How'd you do? Remember, poor, average, good, and then switch sides. And again, it's normal for one side to be a little bit better than the other. So keep that leg flat. The knee is facing you. In, and then pull it in all the way right here. So that would be considered poor. This would be considered average. And then pull it all the way in for good if it's touching your body. And I'm going to own it. I'm not real good at this one. I give myself an average. So good luck.